contains life-saving medications like ivermectin, Z-Pak, and antibiotics. Stock them before they block them.
We're back with Dr. Peter McCullough, a friend of the show, the Wellness Company, and I really appreciate you carving out some time. I know you're slammed, but thanks for coming on today.
Thanks for having me.
So there's some questions I wanted to get to. The food dyes in the food. Why is it so important to get that out? And why has it been so long that they've been used poisoning Americans?
The major food dyes of concern are the yellow and red food dyes. That represents easily 70 to 80% of the artificial food dyes used. And, they've been on the market for decades. There have been clinical studies now done over that period of time showing in animals, particularly mice models, that they actually cause cancer, may cause bladder cancer, other organ cancer. So that's a concern. The second is there's clinical studies, Todd, where for sure these food dyes worsen attention deficit hyperactivity syndrome, ADHD. It worsens it for sure. So it's true when kids eat M&Ms and Skittles and Starburst and Fruit Loops, their ADD gets worse.
Wow. So it's proven. I mean, that's a fact, right? This isn't conjecture.
No, and the FDA has been working on this for a long time. There have been advocacy groups long before RFK and MAHA movement to say, listen, get these food dyes off the market. The FDA has been slow walking this process, like putting their request for comments in, then waiting a year, then another year. It's because the big food lobby doesn't want to make a change. And there are much healthier, natural food dyes that will work and make the products even better. So believe it or not, this is going to help the big food industry in the end.
Is it inertia? Is there some other agenda? I mean, because they're banned in the rest of the world, most of the world, correct?
Right.
It's only here that this happens.
Yeah, I think it's cost. And I think, once a formula is set up and the companies have, everything in their formula in production, they're not likely to change it. But let me give you an example. All this red dye that you see, that can be changed from the toxic red synthetic dye, which is a petroleum product. It can be changed to beetroot extract. And every study on beetroot says that it's very healthy for the heart. I mean, that's just an example.
Well, that needs to happen. And do you think Kennedy's going to get it done, or is there too much resistance, or is it happening already?
It's happening already. The companies have already capitulated. We've heard from General Mills and others. Even Walmart says they're changing their house brand. It's just a matter of when. Some have said, listen, they're going to get it done before the end of the year. Some have said in a couple of years. But, credit to RFK that he got after it and got it over the finish line.
Totally agree with that. So, and I know he has a lot of hurdles he's got to get through, and he's got resistance in a lot of areas. What about the crackdown on pharmaceutical advertising? That really piqued my interest because, I'm a media guy, I own a media company, and that we're competing against that matrix, which is difficult.
Tucker Carlson really broke the news on this. He said that when big pharma approaches a major network like Fox, remember Tucker was on Fox, I'm a frequent contributor to Fox, when they approach a network and say, listen, we want an advertising deal. Let's say Pfizer does for their products. Let's say their blood thinner. Then Pfizer has control of the entire platform. So Pfizer can say, listen, we don't want to see any bad stories come out on our COVID shots, for instance. That's how this works. And so Bernie Sanders and Angus King are going to help RFK. They're proposing in the Senate legislation to ban direct-to-consumer pharmaceutical advertising, just like we ban direct tobacco advertising on TV. It's only the U.S. and New Zealand that allow it. It's very confusing. My wife watches evening TV. She says almost every commercial, Todd, is another drug commercial.
Yes. And they're almost farcical. They dream up these weird names and they show, women just frolicking or whatever. And in the meantime, it's causing real damage or not doing what it says it's going to do. Because you can't read all the disclaimers, right?
Right. And you can't get a fair story, a fair medical story on these networks. So the problem is let's say CNN signs a contract with GlaxoSmithKline or Pfizer or Moderna, what have you. They're not going to have any fair stories across the entire platform, any health stories. So you can't trust them. You can't trust Sanjay Gupta because his platform is, engaging in direct to consumer advertising. So, your platform, the independent media platforms, that's where people are going to learn the medical truth.
So true. What about mRNA? Where are we on this? I've heard a lot of things. Even I, which am somewhat knowledgeable, am a little confused on where this all stands. What say you?
Yeah, we have states and jurisdictions trying to ban all messenger RNA technology. We have our FDA actually rubber stamping the next COVID-19 boosters. We've had our FDA essentially approve respiratory syncytial virus messenger RNA. And they still are fast tracking self-replicating messenger RNA through various, development pathways. We have to get to some working groups in Washington over messenger RNA safety. We have to. We just cannot let this go on. Many are disappointed in this chain of command. This was my Substack today, from Trump to RFK to FDA Commissioner Macri. But none of them are stepping up right now on messenger RNA safety.
There's a lot of issues that, there's a lot of talk. And when we get down to it, it seems like, business as usual going forward. And hopefully that won't be the case. So how could people in the audience, help that effort to put pressure on Congress? Just call your representatives, or what needs to happen?
Certainly call your representatives, decline any messenger RNA vaccines. Now USAFacts.com, which uses the CDC data and really is reporting it fairly, has a lot of good news as of last month. Do you know, for white men like us, only 50% of the country ever was fully vaccinated with 2 COVID shots. It was way less than what people think. Do you know it was only 2% of babies under age 2 ever got fully vaccinated with COVID shots? People have dropped these. And that should be a strong signal. Now, sadly, USA Facts reports that, that at least a third of all the vaccine vials just get dumped down the drain because no one's using it. So, I was disappointed with Elon Musk's Doge effort. You don't hear too much about Doge anymore. But, boy, they should have gone after vaccine waste, fraud, and abuse. We should get that money back from Pfizer and Moderna and Janssen and Novavax. We should have tens of billions of dollars returned to the U.S. government for wasted vaccines.
So what issues do you think, I want to get into some of the products here in a minute, but what issues should people be aware of? There's been a lot of talk of bird flu and other things. Is anything like cooking that people should be aware of health-wise right now?
Yeah, people are going to hear about razor blade sore throat. It's called the Omicron Nimbus variant 1.8.1. It has a prominent sore throat feature. Most importantly, people should twice a day use nasal sprays and gargles. Wellness Company, we feature Immune Mist nasal and throat sprays. Gargling with scope and Listerine is fine. Outside the Wellness Company, my go-to is Xlear, Xlear, and its companion gargle spray. But I do it twice a day religiously. I'm not going to get this Nimbus variant, let it percolate my nose for 5 days, drain to the throat, and then get a razor blade sore throat. It's completely avoidable with nasal sprays and gargles. Everybody should be doing this twice a day before they get sick. Don't wait until you get sick. Do it ahead of time. The prospective trials are very supportable. Everybody should have a COVID-19 contagion kit or Wellness Company general medical emergency kit. Many preppers, many are very worried right now with Middle East tensions, sanctions. And I know, Todd, I know you're kind of a prepper. They get the field kit, which is the big kit, and just get, in a sense, your home pharmacy set. I had a patient today, by the way, who had a Wellness Company kit. And sure enough, he was traveling and he got an infectious diarrhea. And we've got him on the right drugs. He's going to get better quick.
Well, that's the whole point that people need to be aware of, because you have the emergency kits, but once you get them, then you're in, Tahiti and you get sick. You can call the Wellness Company, get online with a doctor, and he'll say, open the kit and do this. That's what's fantastic. And I have that green travel kit. I'm traveling now. I have it in my car. I mean,
Oh,
I
good.
don't go anywhere without it now, because I've used it several times. Once for an insect bite that turned bad, and so
Well,
I've used it.
Well, Todd, listen to this. I took a safari to Africa. Many people know this because we are putting pictures on my platform.
Mm-hmm.
Well, one of the people in our entourage, our South African guide, he was immunocompromised, and because he was getting cancer treatment, he's on a medicine called Neupogen. Well, sure enough, he gets this terrible cut as we're trying to cross this unwisely trying to cross a stream in this jungle hike we are on. And he gets this cut. And I'm like, oh, great. This thing is going to get infected big time. Thank goodness I had the wellness company kit. We cleaned it up. I had all the materials. We got it dressed, sterilized. And, I watched him carefully because, we're out in the bush, no infection. And then sure enough, my wife gets an infectious diarrhea and she gets pretty sick. And I go, oh, gosh, here we go. This is going to ruin our African safari. Thank goodness I had the wellness company kit. She needed the combination of drugs there, and we got her better, and we had a good trip. So the wellness company kits pay off in spades. Everybody should have one.
Completely agree and highly recommend. And you can, by the way, for our audio audience, you can go to twc.health/CDM and use promo code CDM, and you can get the best discount. Tell us about re-engineering of medicine. There's a lot of people. I was talking to a gentleman yesterday who said there was a hospital chain that everybody was saying, don't go there, you won't come home. Right? I mean, there's a lot of medical fear and distrust. How is the wellness company reimagining healthcare, to steal a phrase from Obama?
At the wellness company, we have 24/7 telemedicine. We have nutraceuticals, and we have our own prescription pharmacy. So if you sign up for a membership, you get your prescription drugs for free, you get your supplements for free. I'm older. I'm on some prescription drugs, Todd. I'm a member. So I get my supplements for free and I get my prescription drugs for free. Don't need to depend on CVS or Walgreens. Certainly don't need to depend on a clinic. Many people use the wellness company as a supplemental if they have good insurance. So that way they have coverage. I think if someone's a diabetic or hypertensive and needs frequent visits, I'd go ahead and get the premium membership. The One Wellness, I believe, is called Elite, the premium membership, and even the telemedicine is free. So, I think we should avoid hospitals. I try to never have a patient go to the hospital because that's where all the complications occur.
Well, the whole point is, like during COVID, where we had the lockdowns, I had really bad COVID and I had someone write a prescription and the pharmacy wouldn't give it to me. So that having those drugs in-house is really, really, really important. And you don't need to go to the pharmacy or the doctor if we have another pandemic, because you can just, you have your kit, you have your drugs, you can call up the wellness company, talk to a doc pretty quickly. I've done it. And that's the whole point, right? That you can take care of things at home.
That's true. And not only that, but you can take care of them earlier. So many times people, by the time they get to the urgent care, ER, or hospital, they're days into a problem. And it's a much bigger problem than taking care of it, right away. And so what we find is if you're able to take care of things right away, you can quit. It's like a fire. A small fire you can put out. A big fire, you have to call the fire department and you're in trouble. Yeah.
That's all I got, Doc. Anything else you want to get out there that people just need to know?
Make sure you follow me on Twitter, X, P_McCullough MD. Follow the wellness company, TWC _ health on social media. Go to twc.health /CDM. Use Todd's code. Sign up and become a member. Get the emails every day. They're so useful. There was one that just came out of the Middle East conflict and what we should be ready for. They're probably the most useful email you're going to get is from the wellness company. Make sure you sign up for my Substack, Focal Points. Get all the biomedical updates there on Focal Points. Support the McCullough Foundation, McCulloughFND.org. And, of course, listen to my podcast on America Out Loud Talk News, the McCullough Report. People are basically leaving mainstream media in droves. Now, they may go back. Todd, they may go back if they drop pharmaceutical advertising.
Well,
But
that's possible if they actually become real reporters instead of propagandists.
that's it. But
That-
they're going to have to go out, do embedded reporting, start report the news. I almost don't believe anything that comes through mainstream media because
Completely
I
agree.
can't verify it.
Totally agree. Doc, thanks for your time. Really appreciate it today.
Okay, thanks, Todd.
Bye.